Welcome to another episode of the News Roundup. On today's show, we're going to take a look at a nasal spray which purportedly kills COVID-19 and is now approved in India, Israel, Bahrain, Indonesia, and Thailand. However, as of yet, there's been no mention of it anywhere in the legacy media here in the West. And so, from TrialSite News, I am Adrian, and our episode starts now. So, towards the end of 2021, we here at TrialSite News reported on a nasal spray working its way through its clinical trials that appeared to exhibit the ability to kill 99.9% of the SARS-CoV-2 virus. The drug, called SaNOTize Nitric Oxide Nasal Spray, or NONS for short, is an investigational product that was designed to kill COVID-19 in the upper airways, in effect inhibiting the virus from incubating and thereby making its way to the host's lungs. The spray was developed by Vancouver-based SaNOTize Research and Development Corp, and the product was helped along by testing done at the Utah State University Antiviral Research Institute. By the summer of 2021, the investigational product was evidencing positive results in Phase 2 clinical trials, and by the end of 2021, various nations in the Middle East were already embracing the drug, from Bahrain to Israel. And now, one of India's largest generic drug producers, Glenmark Pharmaceuticals, is gearing up for distribution of the nasal spray in the world's second most populated nation. This, as just days ago, India's regulatory agency, the Drug Controller General of India, or the DCGI, granted market authorization to Glenmark Pharmaceuticals. So now the product is authorized as a medical device targeting COVID-19 in India, Israel, Bahrain, Indonesia, and Thailand. And so we here at TrialSite News have asked the question, what about here in the United States? Why has there been so little news about the drug yet in the mainstream media here in the West? So now let's take a closer look at the product itself. The SaNOTize Nitric Oxide Nasal Spray product is designed to kill the SARS-CoV-2 virus in the upper airways, preventing it from incubating and spreading to the lungs. Based on nitric oxide, a natural nanomolecule produced by the human body and proven with antimicrobial properties, evidence of a direct effect on SARS-CoV-2. The pharmacology, toxicity, and safety data for use of the nitric oxide has been well established for decades. This according to the product's sponsor. They report that the nitric oxide molecule released from the product is identical to the one delivered in its gaseous form to treat persistent pulmonary hypertension or blue baby syndrome in newborn babies. Meanwhile, we here at TrialSite News have been following the development of this nasal spray product by Vancouver-based SaNOTize. And just recently, the company reported its Phase 3 trial achieved its primary endpoint while demonstrating a reduction in SARS-CoV-2 log viral load in COVID-19 patients by over 94% within 24 hours of treatment. And within 48 hours, the viral load was wiped out by 99%. Moreover, a greater proportion of people in the high-risk group, numbering 218, achieved a combination of clinical and virological cure based on the World Health Organization's progression scale. They report a stunning medical time to virological cure at 4 days in the treatment group and 8 days in the placebo group. Glenmark Pharmaceuticals received manufacturing and marketing approval for the nitric oxide nasal spray as part of an accelerated approval process. We spoke to co-founder and CEO Gili Regev, who shared with us that SaNOTize is excited to have Glenmark as our partner for manufacturing and distribution in India. We share the vision for this product and hoping it will become the first line of treatment and defense against respiratory viral infections. And so, with no mention in the Western news media, India's regulatory agency has made a major move in the war on COVID-19. Mumbai-based Glenmark Pharmaceuticals was granted manufacturing and marketing approval from the Drug Controller General of India, or the DCGI, for the nitric oxide nasal spray as part of the accelerated approval process. And so, Glenmark Pharmaceuticals and Canada-based SaNOTize Research teamed up to commercialize the spray in India. The drug is now called Fabispray. which is the first easy-to-administer nasal spray treatment to treat COVID-19 anywhere worldwide. Their commercialization partnership dates back to August of 2021. And as part of this commercialization, the approval is for the treatment of adult patients with COVID-19 who have a risk of progression of the disease, which includes either persons over the age of 45, non-vaccinated people, and/or those with comorbidities. And so, Glenmark Pharmaceuticals will distribute the product to the following countries as a COVID-19 treatment. In the meantime, we here at TrialSite News will continue to monitor the progress of this product, and of course, we'll be keeping you posted on this story as it continues to develop. And that, my friends, brings our episode to a close once more. From TrialSite News, I am Adrian, and I will see you all